What should I expect after a total hip replacement surgery? Hello, my name is Dr. Dan Albright. I'm an orthopedic surgeon in Raleigh, North Carolina. I specialize in hip replacement surgery and hip arthritis surgery. I started in practice in Raleigh in 1994, and I'd like to walk you through briefly after you have a hip replacement. What can you expect? You go to the recovery room, and then within 2 hours, you're up on the floor. And my goal is to get you out of bed within 3-4 hours after surgery. The sooner you're up, the quicker you recover. I do the anterior approach to the hip, which is the muscle-sparing, muscle-splitting operation. And it's easier to get up, in my opinion. And most people are up the same day and then home the next day, which is a real advantage of the anterior approach. So a majority of people are going home by the first day after surgery, later in the day, after receiving physical therapy, after learning how to go up and down stairs, after getting yourself to the bathroom in the hallway, after getting independent. Some patients will go home the second day after surgery. And then when you go home, what should you expect? Therapy comes to your house. The therapy is straightforward. I have no restrictions on your movement. First day, you can squat if you want. I'm not pushing squatting, but there are no restrictions to bending. You can tie your shoes the first day. That's another big advantage of the anterior approach to the hip for surgery. Therapy will walk you at home. They'll show you some exercises, work on stairs, work on getting from a walker to a cane. The sooner the better. And then after a week or two, one, you'll see me in the office, but then two, therapy in the gymnasium, the therapy gym, where you can get on a stationary bike and get working harder with therapy. The therapy is straightforward. It's walking and moving your muscles. And that's the main part after surgery. For elderly folks, 70 years old, you can expect a 2 to 3 month healing process. For younger than that, it's 1 to 2 month healing process. Then after that, you feel good. I mean, the hip replacement becomes part of your body. You forget it's there, which is the beauty of this technology. So we have a real program. When you do a lot of hip replacements, it's a real program and system we have in the hospital and with therapy. So it's nice. It's a real routine. This is good research and good technology. So those are the main points about what you can expect after a hip replacement operation. If you'd like to know more, my website is danalbrightmd.com. You can go there for information. For appointments, my number is 919-863-6808. Thanks.